Thank you very much, Dr. Moeti. And now we'll turn over to Honorable Ms. Kumbize Chiponda, the Minister of Health, Malawi, to shed some more light on how Malawi is preparing for the vaccine rollout and including the potential challenges that you are expecting. Over to you.
Thank you so much. We're still having challenges with the video, but we're talking to the secretariat there to turn on the video. But I'm grateful to be here and to be a part of this conversation, a very important conversation at this point in time. Malawi has not been spared as well from the COVID-19 pandemic, and we are happy with the news of the vaccine, and we are looking forward to having it. So we are grateful to the COVAX platform, Gavi, and of course WHO, with your leadership on the vaccine and how it's going to be distributed, especially the funding part of it, because getting a vaccine is one thing, but the funding part of it, we know most of the countries, we are struggling economically, financially, because of this COVID-19. Now in Malawi, in terms of population, those over 15 years, that's about 11 million. And now AstraZeneca, we are talking of a double dose. That means we're talking of over 20 million vaccines. As a country, we have already developed our national vaccine deployment plan, and it has already been submitted to WHO regional office so that we can have their input. Of course, the plan is to do it in phases. We will start with the frontline workers, also those in the social sector, those with underlying diseases, and also those in humanitarian deployment, and of course, the elderly. So that is our plan. In terms of engagement, it is very important, especially public awareness and sensitization, especially because of the so many negative propaganda which has been going on, especially in the social media. Social media news spreads so fast before the actual facts go out to the people. So it is very, very important for us to sensitize our people and just assure them that the vaccine we are getting, it is safe for them. We need to protect them. But apart from that, we want to bring to awareness that we have to talk of the slingers for giving the vaccine. We have to talk of the logistical issues in terms of transportation with the road networks. This is rainy season. Most of our roads are not in a good condition. But of course, also the storage capacity of our health centers, our hospitals, and also very important, it is the training of our health workers who are going to give the vaccine. So on this part, I think we really need extra support financially so that we make sure that the vaccine gets to our people. So in a nutshell, because of the time, that is what I can say. But as of now, our positivity rate, it has come down from 35 to around 28%, but we were still losing Malawians, very productive citizens on a daily basis. And this is the thing which we have to stop. And we hope that the vaccine will do that for us.
Thank you very much, Honorable Chiponda. And now we turn to you, Honorable Daniel Ngamije, the Minister of Health, Rwanda. Could you tell us more about, we've heard that Rwanda is one of the first wave countries and we're excited about that, but could you shed some more light on how Rwanda is preparing to roll out both the Pfizer vaccine and then eventually the other COVID-19 vaccines as they become available, and what this will mean for Rwanda's response?
Thank you so much, Honorable Director General of WHO AFRO, Dr. Moeti, colleagues, Minister of Health in Malawi, and all participants in this dialogue. I'm very honored to be part of this dialogue. And before I respond to your question, I just want to recall that Rwanda implemented, as other countries, a comprehensive preparedness and response plan for COVID-19 since February 2020. And we came to realize that we have key contributing factors for the success we are noting today, although some challenges are still there. One key contributing factor is strong leadership and governance, especially in mobilizing communities and also engaging partners for mobilization of resources, and of course, domestic resources for funding different activities of the plan. Number two, we came to realize that the resilient health system with strong human resources available for implementing different activities, especially regarding the supply chain, the lab, and other areas in health system was really key. And finally, the use of innovation, especially in technologies for controlling this disease, robots, drones, bracelets for self-isolation, and other measures that we use in tracing of cases. Now, to your question regarding what do we feel as we are part of few countries getting this Pfizer vaccine, especially we are 4 countries in Africa. We are extremely glad. This is an indicator of the performance of the sector, the health sector, because we're able to meet all tough requirements in the readiness tool, from the planning and mobilization of resources, existing of regulatory framework, service delivery, monitoring of the system, all these criteria that are part of the tool. For us, we are happy to have to meet these requirements. And number two, regarding our feelings, is that today, having this vaccine, we are at least able to give a strong response for protecting our staff who are exposed to COVID-19 since the arrival of the first case in Rwanda, 14th March 2020. So we are really happy that at least we'll be able to vaccinate those frontline workers, nurses, doctors, community health workers, and other people involved in enforcement of COVID-19 measures. The last comment is that as we implement this, as we vaccinate these frontline people, it gives us confidence to continue discussion and dialogue with through African Union AVAT mechanism for getting additional vaccines for us to go up to 60% of the coverage. And last, we not vaccinate everybody at the same time. We need to improve case management of people affected by COVID. So we are still investing in getting some drugs, but also we are starting soon to use monoclonal antibodies for at least treating people who are in our treatment centers. We believe that in this context, having vaccine, it gives hope, it gives assurance that if we continue like this, we'll be able to control once we have a good coverage, but at least we'll reduce drastically case fatality rate. This is what I can say for now regarding this vaccine that we are getting from Pfizer and soon from AstraZeneca. Thank you so much.
Thank you very much, Honorable Ngamije, and it is really interesting to hear how countries are already starting the preparation, and we're excited to hear how Rwanda is preparing for this. And now that we've heard from our panelists, it's your turn to ask your questions, our dear journalists. And to do this, please remember to use the Q&A function on the Zoom application. And also remember that you need to provide your name and the news organization that you represent. Anonymous questions will be difficult to treat. And because of time and the huge number of questions we've already received so far, we request you to limit your questions 1 and maximum 2. So I'll start with a question that came in from Malawi Times from the Times in Malawi, and asked by Rebecca Chimjeka. And her question is, there's a lot of negative perceptions around the vaccine. What is WHO doing to make people believe in this vaccine? And this goes to you, Dr. Moeti, and also to Honorable Ngamije in Rwanda. But I'd also like to let us know that we have Dr. Richard Mihigo with us, the coordinator of the Vaccine Preventable Diseases Unit at WHO African Regional Office. Over to you, Dr. Moeti.
Yes, that's a very, very important question because as we have outlined, it's taking a lot of effort to actually obtain the vaccine supplies, to get the vaccines. And we know that there is a global competition. Every government in the world is doing its best to obtain this vaccine for its population so that we can help for life to go back to normal and to start reversing some of the negative impacts of the measures that have to be taken to reduce the transmission of the vaccine. So it's vitally important indeed to counteract the negative messaging, misinformation that's going around about the vaccine. As WHO, with other partners like UNICEF, we are working to support countries to make sure that people get the correct information about the vaccine. And I think we have to emphasize one thing. It's been a very ambitious global project, partnership between governments, the private sector, pharmaceutical companies, to be able to develop these vaccines in such a short space of time. It's unprecedented. And we know that the efficacious vaccines will make a huge difference. So we have a program of information, correcting, monitoring false statements and news about the vaccine, and making sure that we work to get the correct information into the right networks of people at the basic grassroots level. What encourages me is that we know in the African region that in general, people have been positive about having their children vaccinated. It is only lately that some of the anti-vaccine sentiments, messaging, initiatives, and campaigns have started to land here. We need to build on African people's belief in vaccine for their children to help them to understand that something extraordinary was done to develop these vaccines. And of course, to be very factual about the fact that we are learning about the vaccines as we go along, but we know enough about their efficaciousness. We have systems in place for testing them and making sure that they are effective. And we study and understand very well the adverse or negative effects on health and any risks that may apply to certain groups. So this is what we are doing, working together with partners and working very much with governments. And we are relying on opinion leaders. So people who are trusted by others, leaders, the religious leaders, leaders of women's group, young people, other societal leaders, being asked to join this campaign to convince people and give them the correct information that these vaccines, by the time they are being given to people by governments, will have been tested to be safe and to be effective.
Thank you very much, Dr. Moeti. Dr. Ngamije, what would you have to add to what Dr. Moeti said?
Thank you. I think we need to engage our communities in this process of before we vaccinate them. What is good is that they believe in systems in the country. This is not the first vaccine that we are bringing in the country, but they know that we have institutions to regulate this kind of product. We have Rwanda Food and Drug Authorities, which is an institution independent and which is involved in this process of approving the use of this vaccine. Of course, based on different international documentation reviews, like the one WHO is doing. So it gives confidence to our population, saying that what is arriving, it's really meeting requirement. So there is that kind of confidence of our population in institution and with their mandate to make sure that products that are arriving are safe and can be used. Then we also engage health personnel. Like yesterday, we have a webinar with all doctors in the country, and we had to have a chance among speakers, one investigator of Pfizer vaccine in Yale University. So he gave a good presentation and to all this medical personnel, so they can rely and communicate to the rest of our health personnel what is about Pfizer vaccine, how it works, how it's manufactured, et cetera, et cetera. So there is a need of scientific communication within medical personnel to give right information so that they can be good channels to share those information with the rest of health personnel. And then, of course, we engage through leaders as usual. Before we start campaign, we engage different leaders in community to make sure that everybody is concerned, and we need this vaccine. So there is no doubt for us, we don't expect people fearing to get this vaccine, and I will be happy to get the first shot so that to give an example.
Thank you very much. And Honorable Chiponda, we are very happy to see your face and see you live, and our journalists are also happy to see you. So the next question goes to Omar. Omar Mohammed, please go live with your question.
Hi, good afternoon from Nairobi. My name is Omar Mohammed. I'm from Reuters News in Nairobi. I have two questions, one to both ministers and the second questions to Dr. Moeti. In terms of the vaccines that the two, Rwanda and Malawi is getting, I wanted to get a sense, how many vaccines have you actually put orders for? And then how many of that is coming through the African Union platform? How much of that is coming through COVAX? And how much is it is going to come through bilateral deals? And what are the cost differentials between those three sources? And for Dr. Moeti, I wanted to ask about situations where countries are saying that they're not going to get, they don't plan to procure vaccines. Tanzania being one, the health minister said that this week. I wanted to get a sense of what kind of impact that will have in the overall effort to try and defeat this pandemic on the continent. Thank you very much.
All right, thanks, Omar. I'll start with Honorable Chiponda from Malawi, if you could help us take a go at that.
Thank you so much for that question. Under the COVAX platform, we are assured of 20% of our population. Now, in the situation of Malawi, we're talking about 3 million vaccines for our people. And I know that there's also another facility under Africa Exim Bank, which was talking about 15%. And we are also aware of the AU, who are also organizing something about maybe 270 million doses, which are yet to be given to African countries. Of course, there's still a shortfall, which as a country, we have to take responsibility for in order to reach the required percentage of 60%. Because for us to get the herd immunity, we need 60% of our population to be vaccinated. So there's still a shortfall, which as a country, we have to take responsibility for and get the required doses so that we reach the 60%.
Excellent. So we're all still looking towards the 60%, and we shall slowly and by slowly get there. So to you, Honorable Ndamije.
So as I said, we are engaged in effort to get additional doses so that we can reach up to 60% of the vaccine we need, so that we can cover properly our population. The minimum is 60%, but if you can go beyond, that will be okay. Of course, this channel through AVAT at African Union, we count on it. There are mechanisms that are there to facilitate countries to have additional resources for funding those vaccines. African through African Bank or World Bank. So we are already engaged on it. We submitted our dossier, so we are waiting some positive news from that mechanism as well. We have special envoys at the African Union who are really working hard to facilitate the signature of supply agreement with countries for additional doses to what we expect already from COVAX facility, the 20% that we're expecting from COVAX facility. Thanks.
All right, now to you, Dr. Mihigo. We had this question about the countries that have not, Tanzania, which has said no to the vaccine and has actually made a statement. What is your comment?
Well, thank you, Dr. Tuebwe, for this question. I think since the beginning of this pandemic, we have definitely called all the countries in a spirit of solidarity to make sure that the population are properly protected against this deadly disease and the pandemic. So with regards to the vaccine in particular, I think we will we really strongly encourage the country also to adhere to this global initiative, because as you know, until everybody is protected everywhere, we are not going to be all safe in this region. And I think leadership in WHO, starting by Dr. Moeti, we have reiterated the needs to continue to engage the government of Tanzania, and we hope that this will yield some positive results. Thank you.
Thank you very much, Dr. Mihigo. We have now a question from Anita Powell from VOA, and it goes to you, Honorable Chiponda. And it says, NGOs have voiced concern at the slow rollout of vaccine campaigns in lower income African countries, particularly countries like Mozambique, Eswatini, and Malawi. Please explain what is delaying the vaccination schemes there, and tell us what is planned. To you, Honorable Chiponda.
Thank you so much for the question. Like I said in my opening remarks, we already have developed our national vaccine deployment plan. And as we're talking now, we have already started engaging different stakeholders. You know, we're talking of the faith group, we're talking of our traditional leaders, we're also talking of the CSOs and the various groups, which which form part of our community. So that is what we are doing. It is a process. It's not an event. It is a process. You know, we have to continue engaging all the various stakeholders so that we drive the message home. And the most important thing is that at least the vaccine has already been started being used even in Europe, because first there was that, you know, negative propaganda to say, no, the vaccine is just for Africa. No, it is not for Africa. It is also being used even outside Africa. So that gives comfort. But we have to sensitize our people. They have to understand why we need a vaccine. This disease has no cure. For us to protect our people, we need at least a vaccine. So that is the message we are driving home to our people. We already have 6 or 7 vaccines, which we give to our newborn babies. So I'm sure that this one, they will take it well, as long as they get the message that it is for the good of our people.
Thank you very much. Excellent reassurance right there. So now this comes from Hudson Kutesa, who writes for the New Times Rwanda. And it goes to you, Dr. Ngamije. Rwanda may soon get vaccines, but we've had, to some extent, a particular religious group in Rwanda saying they won't take the vaccine. To what extent are such perceptions common in Rwanda, and what is the general willingness, I think, of the population to take up the vaccine?
Thank you. I think this is a small group of people who are generally, they have those kind of misunderstanding, and it's really small group. There are people who are confusing what Bible and whatever religious document are saying with what is happening. So this kind of misunderstanding, we used to have them. It's a matter of engaging them, because all religious leaders, they are really contributing to the implementation of our plan. They have been conducted, and they used to be with us even for other antigen that we are introducing in our calendar of immunization. So we believe that these are marginal people who they have just some misunderstanding, and it's a matter of engaging them and then demonstrating that there is nothing wrong beyond in our vaccine. There is nothing contradicting their beliefs. It's a matter of just talking to them and explain, you know, this is what we'll do.
Oh, thank you. So basically, as you mentioned before, community engagement, especially for these opinion leaders and groups that could be anti-vaxxers. And this is to you, Dr. Mihigo, still from Hudson Kutesa. Some countries are not willing to administer the AstraZeneca COVID-19 vaccine to older people, especially those aged 65 and over low efficacy concerns. Are there concerns about the effectiveness of the AstraZeneca vaccine among all? Are these concerns genuine?
Well, thank you, Fiona, for the question of the journalists. Yeah, I think we are clearly following closely the data that has been published with regard to the efficacy of particularly the AstraZeneca in the older age group. I think it might be too early to conclude that this group should be excluded because the data indeed is demonstrating that at this age group, people are reacting less than in earlier, younger population. But it doesn't mean that this group age have to be excluded for vaccination. So the WHO SAGE recommendation has been to propose the vaccine to all the different age group. And I think this is what we are going to continue to recommend to the country pending further data that probably will emerge as we move forward.
Thank you very much. So now we have somebody who wants to go live. Giola, please ask your question. Okay, we don't see Giola. So to you, Paul Adepoju, from the New Scientist, please go ahead with your question.
Yeah, thank you very much. So I have a question for Dr. Moeti. I'd like to know, why do we have only about a dozen African countries that are signing up for COVID vaccines via the EVAT platform, and what's the trend of African countries pursuing their own vaccine plans outside the central plans mean for the continent? I also like the minister to share how they are balancing national interests regarding solo vaccine negotiations with the regional COVID-19 vaccination plans. Thank you very much.
Thank you. So I'll give your question to Dr. Mihigo, and then the two ministers can follow. Over to you, Dr. Mihigo.
Can you please, I think I have a small issue with connection, to repeat the question for me?
Paul, do you want to repeat your question?
Yes, so I'd like to know, why do we have only about a dozen African countries who have signified their interest in COVID-19 via EVAT platform, and what this trend means for African countries pursuing their own vaccine plans outside of the central plans?
Okay. So I think, as you know, the EVAT platform is quite a new platform that has been set up by the African Union, and the supply portal has just been opened 2 weeks ago. So to see already a few countries, 16 countries that have already expressed interest to acquire vaccine through that portal, I think it's quite encouraging, because this is just the portal was open a couple of days ago. So from the information we are getting from the Africa CDC, I think that is quite something which is encouraging. And I believe that all countries will definitely, in the coming days, take advantage with this additional mechanism that is complementing the COVAX facility to get additional vaccine, as we have heard from the Honorable Minister of Health from Rwanda, as well as Malawi.
Thank you very much. So I'll also ask Dr. Ngamije to make a comment.
Yes, I think we need to be coordinated so that we can negotiate good price for vaccine. That's why, as African countries, we are part of this AVAT, or African Union mechanism. We should be well coordinated by expressing our interests to use that portal, that platform. It helps to negotiate good price. So for us, we are engaged and we applied already. It will allow our leaders in African Union to negotiate those good price. Rather than having each country negotiating itself, the price will be higher than if we go for kind of backer grouped procurement through African Union, so that we can reach this 60% of coverage that we want. That's the way we are convinced, and that's the way we shall be doing.
Okay, thank you very much. We have another question saying from Ferdinand Uwimana, and this I'll give to you, Dr. Nixie Gumede from WHO Afro. how is WHO controlling these new variants of coronavirus that are found in different countries? And are these vaccines being distributed like Pfizer, effective against these new variants? Or are these vaccines specifically designed to tackle them? Over to you, Dr. Gumede.
Thank you so much, Fiona. And that's a very good question, and it's been asked by so many journalists previously. The World Health Organization has developed a very good genomic surveillance system in the continent that is covering all the countries from south to north and east to west. And these countries are the ones that are developing the genomic sequencing data on a weekly basis. As you know that without the genomic information, no one will be knowing what is going on as far as the mutation of the coronavirus currently. So we have a representation of laboratories represented all over, and these countries, the countries that are not having these laboratories, they are actually requested to forward their samples for sequencing to the referral laboratories that has been assigned by WHO. And this work was in collaboration with the Africa CDC. So there have been several scientific studies that have been taking place, especially from those countries that have identified a new variant, such as South Africa. And they further on studied to find out what's going to be the impact of the new vaccine that is proposed to be implemented or to be rolled out to the countries for as far as the new variant is concerned. So the studies have shown that even though there is a very low neutralization effect to this to the antibodies for this new variant. However, the scientists are very confident that there will be no impact of the vaccines as far as the new variant is concerned. So we are pretty sure that the new vaccine coming in is not going to interfere with the new variant that has been identified in several countries in the African region. Thank you so much, Fiona.
Thank you very much, Nixie. So we have a question from Hiponda in Malawi to the Minister of Health Malawi. Malawi has already procured the COVID-19 vaccine as announced by the president on Sunday. However, he also indicated that our scientists will test the vaccine in our own labs upon arrival. Please clarify. And there's a second question, is Malawi buying the vaccine on its own, or is it getting it from WHO, and how much? Because the president did not come out clear on this, much as I think you had hinted on this. Over to you, Honorable Chiponda. Okay, I think we could have lost Honorable Chiponda.
Can you hear me now?
Yes, we can hear you. Thank you. Go ahead.
Okay. Now, I was saying in Malawi, we have the Pharmacy and Medicines Regulatory Authority, which means whatever medicines comes into Malawi, it has to go through the procedures and processes just to make sure, because we have that regulatory authority, to check whatever medicines we get into Malawi, whether we are buying, whether it's a donation, but we use that protocol to do that. So the same with these vaccines, even all the vaccines which we get, or the ARTs we get, they go through the same process, each and every batch, each time. It's not that you don't trust them, no, but we do that process, just to safeguard our people. So the vaccines, they also go through that process by our regulatory authority. Now, in terms of the president talked about procuring 1 million doses of the vaccine. Like I said before, from COVAX, we're only getting 20%. And maybe from the other resources or the other organizations, we'll get up to maybe 30%. We'll still have a shortfall of 30%, which as a country, we need to take care of. And indeed, our president, Dr. Lazarus Chakwera, he's already looking into that to see how we can secure funds to get the vaccine, because literally we are against time. It would not be good to get the vaccines and then you pass a lot of time before you finish or you get to the 60%. It has to be a little bit continuous so that we reach the 60% and we can get the herd immunity, which we are looking for as a country. So as a country, we're also pursuing other means and ways of getting the shortfall for us to get to the 60%.
Excellent. We don't want to start and stop. So all means are being put in place. So this is to you, Dr. Moeti from Giola Foster with DPW. Some African countries are paying a much higher price for vaccine doses than many European countries. Why is this the case?
Okay, thanks very much, Fiona. First, very sorry about our connection issues. We've been up and down in this press conference. I wanted to add something on the regulatory processes. Indeed, as the minister said, each and every country's regulatory authority needs to be satisfied that the vaccine is safe and efficacious and regulate that, decide that it can be used in the country. We actually have a partnership platform of the regulatory authorities in the region that are working together. We believe that if they do the process together, this platform is called the AVAREF. If they do this process together, we can speed up looking at each of the vaccines to spare each and every regulatory authority doing this on their own. Because we've observed in the past that this can be a delaying factor in the step of getting new tools like vaccines into countries. So I'm certain that Malawi is part of this platform. These experts, they're sharing their capacity, they're looking together, developing a common methodology so that the regulatory authorization can then happen relatively quickly in each country. And of course, as WHO, we serve all our member states by carrying out our own analysis of the data as WHO and issuing emergency use licensing, which we then place at the disposal of our member states' regulatory bodies so that it can help them as well to do the rather speeded up regulatory authorization. So the question was asked about pricing, whether African countries why African countries paying more than other regions for the vaccine. I think it's just a feature of a global market, especially one that is so competitive that there will be differential pricing for one reason or another. For example, we know that Israel, which is a high-income country, also paid a higher price than, for example, the European Union for the Pfizer vaccine. Countries have gone through a process, including, for example, for the Pfizer vaccine, of making financial commitments. So those that made the early financial commitments at the time when the vaccine was still being developed, before the data came about its efficacy and its safety, took the risk, if you like, of investing and possibly losing their money if the vaccine was not as good as it has turned out to be, and therefore are being offered a preferentially lower price than others who have come on board for this vaccine later. So countries buying the vaccine later will be requested to pay higher prices. I think there's also the issue of volumes. Of course, those who are buying larger volumes are able to negotiate lower prices. We recognize this is the reality of global markets. Of course, it is unfortunate to have poor countries paying more than high-income countries, but we're learning more and more how to manage this process. And we think that the COVAX and the work that the African Union is doing, also pooling the procurement among all the countries, is one way to drive for more affordable pricing.
Thank you very much, Dr. Moeti. And now we go live to you, Christina Okello from the Radio France International. Please go ahead with your question. Okay, we don't seem to have Christina go live. So Christina is asking a question to the two ministers, and I'll give this to you, Honorable Ngamije and Honorable Chiponda. My question for the two ministers: did you receive much support from the African Union, the Africa cities in particular, in preparing to face the pandemic? Were you satisfied with this support, or was your COVID response down to you alone? Over to you, Honorable Ngamije.
We received strong support from African Union. Maybe if the person is not aware, there was a platform for procuring COVID-19 commodities, and we use that platform for us to procure at good price different commodities like PPEs, tests, kits, etc., etc. So we really received a strong support from African Union, and grateful for that. And we are grateful for what they are doing to facilitate African countries also to get additional vaccine by making some financial arrangement with the African Bank and the other banks, so that we can be able to mobilize additional resources for funding additional vaccine. So I think they are doing a good job for sure.
Okay. Excellent, Honorable Chiponda.
So I would want to agree with the Honorable Minister from Rwanda that we get very good support. And in fact, we are always, engaging in different talks. Only last week, we had a Zoom, a webinar meeting as well, chaired by President Cyril Ramaphosa as well. We're all part of it. So they've been very supportive in terms of support for us to get the PPEs, the testing kits, the technical support as well. And indeed, they're also looking at the financing part of it, so that us, the least developed countries, we still get our share of the vaccines. So they're very supportive, and we are happy with that.
Okay, très bien. Très bien,
excellent. Merci. Okay, so the next one, I'll give it to you, Dr. Mihigo, and this is from Ms. Bai from the CCTV journalists. And it is in order to help developing countries in urgent need, China decided on Wednesday to offer 10 million COVID vaccine doses to COVAX at the request of the World Health Organization. Does that mean that Chinese vaccines have been approved for emergency use listing? And how many of these doses would be distributed in Africa?
Okay, thank you, Tuebwe. The COVAX facility is exploring a broad range of vaccines in its portfolio. We are looking at the vaccines that are showing good efficacy and safety data. So I think this announcement by China, it's a very good development in terms of global solidarity. But so far, the two leading candidate vaccine from China are still under evaluation by the WHO pre-qualification team. And if it's proven that these vaccine from the data that will be made available are also meeting the requirement, I think that will be something very encouraging for the COVAX. So I think the real search for the moment is to expand as much as we can the vaccine portfolio with safe and efficacy vaccine. And once this point has been reached, I think the next step in terms of distributing the vaccine across the country in the initiative or the facility, I think will be done, of course, on the basis of the needs that country will express. But all in all, we believe that that is a new good development, and we're looking forward to see the evaluation that is currently ongoing on the Chinese produced vaccines.
All right, thanks, Dr. Mihigo. This is for you, Dr. Moeti. This is from Anna Pojul Mazini from the Daily Telegraph. How much of a concern are fake news surrounding the vaccine in your respective countries and in the African region in general?
Thank you. Yes, I think this is similar to a question that was asked earlier. It is a huge concern, and it's something that is being addressed, needs to be very strongly addressed so that people understand the facts about the vaccine and some of the false stories that are going around, including that African people were being used as guinea pigs for a vaccine they will not get, and other matters about how the vaccine can be harmful to people's health, the plots that are there to harm African people by rich countries sending the vaccines in. These are all not true, and it is a big concern. And I think it was already said by myself earlier and by the minister from Rwanda that work is ongoing right now, and it's very important to scale up these efforts to make sure that people are reached through various means, but with the correct information about the vaccine, and to emphasize that we know enough about these vaccines and would never, as international organizations like WHO and governments, agree to license vaccines that might be harmful to the population. There are systems in place to look into this. And we will work very hard with different partners, with governments, with civil society, with community leaders, with religious leaders, with others who can influence people's population, people's knowledge and beliefs to undo the infodemic, as we like to call it, of false information about vaccines.
Okay, thanks a lot, Dr. Moeti. And as we reach towards the end of our discussion today, we have a question to the Honorable Minister of Rwanda from Aimable Uwizeyimana. And she says she's a journalist for Huguka Radio. At present, some people are of the opinion that COVID-19 vaccine is affecting health mainly due to beliefs. I believe this is about the side effects. How are government agencies ready to help the public better understand the importance of this vaccine?
I think I will repeat what I said earlier. Before introduction of the vaccine, we really engage communities to make sure that they are aware of the vaccine, especially those in health services domain. But for the general population, we tell them how the vaccine is efficacy. We share with them data that are there. And we need to explain that them that we have a strong pharmacovigilance system which will monitor any side effect and we report it. So they should just be informed that we agreed to enter the vaccine and we monitor the use of it, and any side effect we report and make sure that it doesn't harm any of the Rwandese who get the vaccine. So it's a matter of being with them, sharing information. We are transparent in whatever we'll be doing. They should not fear anything.
Basically, continuous communication and advocacy. So now we go to you, Catherine, from France 24. Please go live with your question. Catherine? So if Catherine is not ready, I'll go for the last question to you, Dr. Mihigo. And it says, when is the first delivery of vaccines through the COVAX due to arrive in an African country? And which countries are due to get them first? I know Dr. Moeti talked about this earlier, but I'll also add this one that says the aim of COVAX is to guarantee fair and equitable access for the country, for every country in the world. However, clearly that is not the case, as vaccination campaigns in Africa are lagging far behind countries in the global north. Has the aim of the COVAX failed in this regard?
Well, let me start by saying that, as Dr. Moeti mentioned it in her inaugural remarks, so the COVAX has announced some very positive development recently. So we have the countries that are going to introduce the Pfizer vaccine as part of the first wave in the region. So we have 3 countries in the WHO African region. Rwanda, which is represented today by the Honorable Minister of Health, South Africa, as well as Cape Verde, the 4th one in Africa being Tunisia. So we expect that these countries are going definitely to introduce the vaccine in the next couple of days, pending the final regulatory agreements finalized between those countries with the vaccine manufacturer. So we believe that it's quite very, very imminent. But the good news is that the rest and the majority of the country in the region are going also to start their vaccination probably in the next couple of days, because they've also received indicative allocation of the AstraZeneca vaccine. So we believe that this is a matter of days as well to see those countries starting to vaccinate. On the question of COVAX and its promise, by the way, of equitable distribution, we believe that the ambition of the COVAX and the goals are now on track with this new delivery that are going to start flowing in the countries. It's true that there have been some time that has been taken between the high-income country and the low-income country supported through COVAX. But as it has been repeated in several occasions, I think many countries took the opportunity of this window even to get very well prepared for the rollout of the vaccine in the coming days. So we believe that that small lag between a matter of weeks between the global north and global south have been used positively to improve preparedness, to improve the preparation of the country, so that when the vaccine arrives, they will immediately be rolled out because the country have already have their system prepared and ready to start vaccination.
Thank you, Dr. Mhigo. And while you're still at it, we have the final question from Catherine Bokonga from France 24, and she says, do the countries part of COVAX, are they able to choose the vaccine that they would want to use?
Well, the COVAX facility came up with two approaches. For the AMC-supported countries or the low-income countries, in general, they are going to receive one type of vaccine throughout the process. And this vaccine, indeed, is going to be provided based on all the data science that is known to make a huge impact in their country. But for the self-financing countries that have paid a premium, I think they've got the option of opting out for the first choice that has been given to them. So they could potentially move to the second choice if necessary. But all in all, I believe that the critical message across here is that most of the vaccine, or if not all the vaccine that are going to be provided through the COVAX facility, we believe that are the vaccine that are safe, efficacious, and which will make the impact. So I think that's probably the major point we need to focus on.
Thank you very much, Dr. Mhigo. We indeed do still have very many questions. And now, as we wrap up, I want to promise our journalists that Dr. Mhigo will remain with us for 15 minutes to be able to answer your questions, and more so to also those that had your questions in French. So now, as we come to an end of this special press conference, let's turn to our panelists and hear their final messages. And I'll give them a minute each. And I'll start with the gentleman, Dr. Daniel Ngamije.
Thank you so much. Closing remark, I just want to say that it was a pleasure to share with you the situation that we are facing regarding COVID-19, and especially the new development regarding the soon arrival of vaccine, probably end of this month. We are very excited for having at least now a real response to COVID-19 with the vaccine. And as I said, our health personnel have been exposed since the first case arrived in Rwanda. So we are happy at least to protect them so that they can go with confidence doing their job and protecting all Rwandese by treating those who are infected. The second message and the last one is that we are starting a journey. We're not getting all vaccine that we need the same this month. So we'll continue to cover or to vaccinate according to the level of risk. We'll make sure that through different mechanisms, COVAX and African Union platform, we'll make sure that we have sufficient vaccine for our people. Thanks.
Thank you very much. And I'll now go to you, Honorable Chikonda from Malawi, to give us your parting words.
Thank you so much. I would want to thank WHO and also Gavi, UNICEF, and CEPI for the COVAX platform. But we also want to thank AU for the leadership which is giving to us as we are fighting this COVID-19. We're excited about the vaccine which is coming to us. But I think we still have to keep in mind that as we're excited about the COVID-19, we still have some other challenges in the health sector. We still have people who are still dying from malaria and also, HIV-related AIDS, and also people that still, are struggling with tuberculosis. We have new infections. So I think we need to be very, very balanced so that we do not lose the gains which we have made in the fight against the other epidemics. Thank you so much for giving me the platform. Thank you.
And thank you very much for joining us too. We're really glad to have you. And finally now to Dr. Moeti, who has unrelentingly and done an excellent job to keep up with these pressures and keeping Africa well informed. Over to you, Dr. Moeti.
Okay, thanks very much, Fiona. First, I'd like to thank again the ministers for having joined us and shared such precious information, your insights, intentions, which is really positive with the region and the journalists, our colleagues, and the world. I'd like to end just on this note that, you know, clearly global solidarity is still a work in progress. It was our ambition, it was our hope. It has not delivered to the extent that we had hoped, but it is still a work in progress. We are still doing our advocacy for donations from countries that have secured more vaccine to cover the entire population. That's one point. And then secondly, that this entire enterprise is not static. It is moving. So even as we are making the targets and estimates of what we'll be able to cover, the pharmaceutical companies are working with others to expand their production capacities, and we may see the volumes of vaccine becoming available later increase, so that even the targets are not static. We may be able to be more ambitious as more vaccine becomes available, because I'm certain that the money will follow the availability of the vaccine. And then just to end on that note again, I actually don't believe that Africa is lagging far behind. It's true that we have lagged somewhat behind. I believe that it's possible to work very well in the meantime to start very strong as the vaccines are starting to land on the continent in the next few weeks, and really work hard to make sure that we cover the right groups, the most vulnerable groups, those that are dealing with sections of the economy that need to get restarted, those that might die if they get infected, and progressively reach herd immunity and normalize life to what will be then the new normal. And I want to echo the minister from Malawi again. We must continue at the same time to deal, and we are going to support countries to deal with other health problems, as well as to continue the prevention work of the COVID-19. The vaccine is not going to switch us off in an instant. So we must and are going to work on all these fronts continuing into the future, the near future, at the same time. Thank you very much.
Thank you very much, Dr. Moeti, and great rays of hope there and reassurance, and Africa indeed can do it. We've done it in the past, and this time around we'll also do it. Again, to add my words to Dr. Moeti, thank you very much, our ministers. The Rwanda, we wish you all the best as you go for the first wave. The Honorable Minister Malawi, we are also with you, and we look forward to your country starting. Thank you, journalists, for being with us, and hope to see you again for the next presser next week on Thursday. Have a good day. And please remember that Dr. Mihigo still remains with us to answer questions that were not, that you had that we did not have time to answer in the main press briefing.
Oui, bonjour aux journalistes francophones. Donc, on va prendre le relais avec le Dr Mihigo qui est en ligne pour répondre à certaines questions que nous avons reçues. Donc, on va faire le tour et après, si vous êtes en ligne et que vous voulez rajouter une question, vous pouvez peut-être lever la main et on pourra voir dans quelle mesure, si le temps le permet, on pourra aller vers vous. Donc, Dr Mihigo, bonjour, est-ce que vous êtes en ligne?
Oui, bonjour, Khadija. Oui, je suis en ligne.
D'accord. Donc, nous avons reçu une question de Mousseza Sikourou de la RDC. Elle travaille pour le média en ligne laprunelle.info. Donc, elle est en train de, la question qu'elle pose est la suivante. Depuis plusieurs jours, des pays africains ont lancé leur campagne de vaccination contre la COVID. Mais comme vous le savez, la plus grande majorité n'a pas encore commencé le processus en vue d'obtenir le vaccin. Alors, où en est-on avec le programme de l'OMS pour appuyer ces États? Quel pourcentage de la population sera concerné? Et que fait l'OMS pour inciter les États à s'approvisionner avec leurs propres moyens en attendant ce programme? À vous, Dr Mihigo.
OK. Merci beaucoup à la journaliste de la RDC pour cette question. C'est vrai que, comme nous l'avons souligné dans la première partie de cette conférence de presse, Nous avons certains pays au niveau de la région africaine qui ont déjà commencé à vacciner. C'est le cas les Seychelles, l'île Maurice, qui ont commencé depuis quelques semaines, mais également le Maroc, l'Algérie et l'Égypte. L'Afrique du Sud, qui a reçu également un grand nombre de vaccins, devra commencer la vaccination dans les jours à venir. Donc, voilà un peu la situation. Et comme on l'a souligné, tous les autres pays ont reçu de la part de COVAX, qui est l'initiative qui est pilotée par l'OMS, Gavi et CEPI, des indications sur les nombres de doses que ces pays vont avoir dans les prochains jours. L'objectif étant que la vaccination commence le plus tôt possible et nous espérons que cela se passera avant la fin de ce mois de février. Alors, les doses qui ont été indiquées, qui seront envoyées par l'OMS et COVAX, vont couvrir au total 20% de la population d'ici la fin de l'année, mais en commençant par une première allocation qui va couvrir environ 3%, 3,5% de la population. Et cette première partie vise à vacciner notamment les agents de santé qui sont sur le front, qui sont extrêmement exposés, comme nous l'avons entendu par la voix des ministres du Rwanda et de Malawi, mais également les autres personnes vulnérables, et notamment les personnes âgées qui sont les plus à risque pour mourir de cette maladie. Et au fur et à mesure que les doses deviendront disponibles, et nous l'avons entendu de la part de la directrice régionale, la dynamique va certainement changer parce que certainement que les approvisionnements vont monter en puissance pour effectivement atteindre le 20% d'ici la fin de l'année. Et par rapport à la dernière question qui fait l'OMS pour appuyer les pays pour avoir des discussions bilatérales, nous voulons plutôt décourager les pays à se lancer dans les discussions bilatérales pour l'achat de vaccins et prendre plutôt l'opportunité d'utiliser les plateformes communes telles que COVAX ou l'initiative de l'Union africaine, AVAT, qui au moins permet un achat groupé et en permettant un achat groupé va permettre la réduction des prix des vaccins. Donc, nous encourageons fortement à ce que les pays, au-delà des doses qui sont garanties par COVAX, mais également par l'Union africaine, qu'ils puissent travailler à travers ces deux plateformes pour avoir les doses additionnelles au lieu d'avoir des négociations bilatérales qui malheureusement exposent les pays à avoir des prix de vaccins assez élevés.
D'accord. Merci, Dr. Migo. Il y a une autre question de Judith Assina. Elle est de la radio Svein de RDC. Elle demande combien coûte le vaccin contre la COVID-19 et est-ce que le prix varie d'un pays à l'autre ou est-ce que l'OMS se rassure de l'unicité des prix? À vous, Dr. Migo.
OK. En fait, c'est une question intéressante parce que nous n'avons pas un seul vaccin contre la COVID, nous avons plusieurs vaccins. Et ces différents vaccins, malheureusement, viennent avec des prix complètement différents. Donc, c'est difficile de donner un seul prix parce qu'il n'existe pas deux prix, mais il existe plusieurs prix en fonction des vaccins qui ont été jusque-là mis sur le marché. Donc, l'OMS, en ce qui concerne l'unicité de prix, effectivement, travaille à travers la plateforme COVAX pour être sûr que les pays qui travaillent à travers cette plateforme puissent avoir les prix les plus bas possibles du marché. Et d'ailleurs, c'est ce qui se passe à travers les premières doses de vaccins tels que AstraZeneca qui vont être livrées aux différents pays dans les jours à venir. Donc, en conclusion, nous pensons que nous n'aurons pas un seul prix, mais plusieurs prix. Et l'OMS fait en sorte à ce que les pays, surtout les pays les moins avancés, les pays en voie de développement, puissent avoir le meilleur prix possible à travers l'initiative COVAX.
D'accord. Il y a une question de Abdoulaye Diallo. du journal Le Soleil, un quotidien du Sénégal. Il voudrait savoir, est-ce qu'il y a des risques que les vaccins qui sont disponibles ne puissent pas avoir la même efficacité en Afrique?
Ça, c'est un vrai risque, effectivement. C'est un vrai risque. Comme on le sait, malheureusement, les études cliniques montrent que lorsque des essais sont faits sur différentes populations et dans différents écosystèmes, nous pouvons avoir des réponses immunitaires complètement différentes. Les données, par exemple, qui ont été publiées en début de semaine pour ce qui concerne le vaccin de Johnson & Johnson, où nous avons des sites d'essais cliniques en Afrique du Sud, mais également aux États-Unis et ailleurs, montrent effectivement une différence entre l'efficacité de ces vaccins à travers ces différentes populations et ces différentes zones, et le niveau d'efficacité étant le plus bas pratiquement sur les sites d'essais cliniques en Afrique. Donc, il s'agit bien entendu des données encore préliminaires, mais c'est ce qui, encore une fois, renforce l'intérêt d'avoir des essais cliniques en Afrique, ce qui nous garantirait au moins des informations et des données sur l'efficacité de ces vaccins sur les populations africaines.
D'accord, docteur. Il y a une question qui est déjà revenue. Je sais que vous l'avez déjà traitée par le passé, mais comme elle revient plusieurs fois, ça serait intéressant parce que la répétition est pédagogique. Donc, il y a Adjima David Chombiano de LCA qui voudrait savoir quelles sont les cibles des premières campagnes de vaccination.
Non, je crois que c'est très important qu'on les souligne parce que nous sommes dans une situation où les nombres de doses de vaccins disponibles ne sont pas suffisants pour couvrir toute personne qui en a besoin. L'OMS a développé des directives sur la priorisation des populations cibles par rapport aux vaccins COVID qui sont en nombre suffisant. Et dans ces directives, nous recommandons à ce que, premièrement, soient ciblés les agents de santé qui sont en première ligne pour la réponse contre la pandémie, et ceci pour maintenir l'intégrité du système de santé dans les différents pays. Parce que nous voulons que les hôpitaux continuent à fonctionner, à prendre en charge non seulement les malades COVID, mais également les autres pathologies qui, comme on le sait, continuent. Donc, la cible du personnel de santé reste prioritaire pour maintenir cette intégrité. Deuxièmement, la COVID a démontré que certaines populations ou sous-groupes dans la population sont particulièrement vulnérables à la maladie, et lorsque ces personnes sont infectées, ont le plus grand risque de décéder. Il s'agit des personnes âgées, il s'agit des personnes qui ont des comorbidités existantes, notamment le diabète, l'hypertension artérielle et d'autres maladies chroniques. Ces personnes sont disproportionnellement affectées par la maladie et ont un grand risque de mourir. Et enfin, ça dépendra des différents pays. Après avoir couvert ces groupes à haut risque, quels sont les autres sous-groupes qui sont importants pour la réouverture de l'économie des pays. Certains pays, par exemple, ont priorisé les agents travaillant au niveau du secteur de tourisme parce que ces pays vivent à 100% des revenus du tourisme. Donc, ça fait bon sens qui cible ces personnes-là par rapport à d'autres parce que ça permettra au pays de facilement commencer les activités économiques. Donc, voilà un peu, grosso modo, la logique et les directives que nous avons édictées sur la priorisation des populations cibles pour la vaccination contre la COVID.
D'accord, docteur. Donc, je vous remercie. Je pense que le reste, ce sont des commentaires pour nous remercier du temps qui a été accordé aux confrères. Donc, je pense qu'on est venu au bout des questions, à moins que vous n'ayez un mot de conclusion. On va...
Non, merci. C'est encore une fois de remercier les membres de la presse parce que je pense que c'est un partenariat assez important que nous tenons effectivement à maintenir avec les membres de la presse. Nous pensons qu'il est important que l'information la plus pertinente possible puisse parvenir au niveau des populations et des communautés, que nous puissions tous contribuer à lutter contre les rumeurs et les fausses nouvelles qui circulent sur les réseaux sociaux. Donc, nous vous remercions beaucoup pour l'intérêt que vous portez à cette conférence de presse et nous espérons que nous allons voir la semaine prochaine. Donc, je viens de voir quelqu'un qui dit quel est le titre du docteur Mihigo. Donc, moi, je suis le coordonnateur régional du programme de vaccination au niveau de l'OMS et le coordonnateur adjoint de la lutte contre Covid-19 au niveau de la région africaine pour l'OMS.
Merci, Dr Mihigo. Merci pour votre disponibilité constante. Donc, merci encore une fois aux frères et sœurs des médias et à la prochaine. Merci et au revoir.
Au revoir.